It has been a hot debate for years, the hottest debate in our state, actually. But today,
that's right. State lawmakers say they have, in fact, reached an agreement to expand Medicaid.
The State Department of Health and Human Services says that means 600,000 people, or about 1 out of every 17 of your neighbors, would get health coverage. To understand the change, let's start with the current system. Right now, to qualify for Medicaid, you have to have a low income and meet one of these other requirements. Be pregnant, be responsible for a child under 18, be blind, have a disability or a family member living with you has a disability, or 65 or older. Under Medicaid expansion, the only requirement would be to have a low income. That's it. According to healthcare.gov, the new threshold would be anyone who makes under 138% of the federal poverty level. Those are who would qualify. That means about 20 grand for a single person, 27 grand for a family of 2, 34 for a family of 3, and 41 for a family of 4. Now, the numbers will be a little different depending on which county you live in, but they should be somewhere around these amounts.
To give you a little more context about why this is so important, more people with health care coverage means less people dying. Research from the University of Michigan found after other states expanded Medicaid, they had an average 9.4% decrease in the number of people dying every year. Now, that's part of the reason that doctors and healthcare professionals have backed Medicaid expansion for a long time.
Heart disease, stroke, cancer, diabetes, name a condition, and all those patient advocacy groups are supportive of Medicaid expansion because we know it can improve health in North Carolina.
Research also shows when more people have health insurance, it frees up money for them to focus on other needs, real needs. I'm talking about the amount of food insecurity drops after Medicaid expansion. There are also less people who get evicted, and about 12% less people file bankruptcy. There are also less late child support payments, and one that impacts really everyone here, there's a reduction in violent crime in states that have already expanded Medicaid.
31 other states have already expanded Medicaid over the past decade. Democrats in North Carolina always wanted to do it. Republicans were holding out, saying it could put a serious financial strain on our state. So why, after all this time, have Republicans changed their mind? It mostly has to do with money and how much of it is coming from the federal government. The federal government has always offered to pay for 90% of the expansion, leaving North Carolina to cover the remaining 10%. But Republicans were worried that one day the feds might decide they want to stop sending that cash, stiffing us with the bill. But now that we've been through President Obama's administration, President Trump's, and President Biden's, with the federal government still offering the same level of funding, North Carolina Republicans felt it was safe to move ahead. Plus, the federal government has sweetened the pot, offering even more money, a $1.5 billion bonus for expansion, plus an extra $800 million every single year after that. Money that's not tied to health care. It can be used any way the state wants to. Also, as long as they are trying to approve Medicaid expansion, Republican lawmakers said they also want to negotiate a deal that would allow more competition between hospital systems to hopefully drive down health care prices for everyone, not just folks on Medicaid.
Well, Governor Roy Cooper was not part of negotiating this time around, but he has been pushing for Medicaid expansion for a very long time now. And after the news broke today, he tweeted, "An agreement by legislative leaders to expand Medicaid in North Carolina is a monumental step that will save lives, and I commend the hard work that got us here. Since we all agree this is the right thing to do, we should make it effective now to make sure we leverage the money that will save our rural hospitals and invest in mental health. I look forward to reviewing the details of the bill." Well, Republican leaders say Medicaid expansion will be included in the state budget, so that means it would start after that's approved, which would be sometime this summer.